Hello and welcome, and thank you for being part of WorkSafe's first Health and Safety Month webinar for 2022, Reducing Workplace Harm and WorkSafe's Challenges and Priorities. My name is Cameron Ling, and I'll be your host this morning, and it's an absolute privilege to be part of WorkSafe's Health and Safety Month again this year. I've been involved since 2017, and it really is a passion of mine to be able to spread the message around being safe in the workplace. My dad was involved in a very serious workplace accident when he was a young man as an apprentice butcher when he was 19 years of age. And it had a major impact on his life, a major impact on our family's lives. And we saw firsthand what one simple little mistake, one little reflex action when there's not the right protective mechanisms in place can do to somebody. He was an apprentice butcher and he lost his right hand in that horrific accident. He's an incredibly resilient man, is my dad. But it's something that has impacted him for now 50 years, and he really struggles to talk about it. But you think if we can make a difference now and get that message out there, hopefully accidents like that don't happen in the future and don't impact people's lives and people's families' lives. So that's why I'm here and part of this Health and Safety Month again, and it really is, as I said, a privilege to be a part of it. Today, I am joined by two of WorkSafe Victoria's executive leadership team. WorkSafe's CEO, Colin Radford. Welcome, Colin.
Thanks, Cameron.
Great to have you with us. And also joining us this morning is Executive Director of Health and Safety, Dr. Narelle Beer. Welcome to you, Narelle.
Thanks, Cameron. Great to be here.
It's great to have you with us as well. Thank you both for taking time out of your very busy schedule to be with us. I know the work of keeping workers safe and healthy never, ever stops. So we really appreciate it. In the first half of this 45-minute session, I'm going to ask Colin and Narelle a series of questions about WorkSafe and their role, some of the workplace health and safety challenges in Victoria at the moment, and what WorkSafe's priorities are to prevent harm and how you, our audience, can also play a part in this. And then we're going to open it up to questions. We want questions from you and that engagement. And you'll see on the right-hand side of your screen, there's a chat box there. If you can use that to ask your questions, that'd be brilliant. Feel free to start entering those questions whenever you want. If you've got one already set to go, pop it in there so that when we get time for the question and answer part of this session, it's going to be there for me to ask on your behalf. Just type them out and send them in by hitting enter. Righto, let's get straight into it. Starting with you, Colin. For those on the call today and joining us this morning, can you perhaps give us a brief overview of WorkSafe and what you do?
Certainly, Cameron, and thanks for joining us this morning. To everyone who's here, it's really great to be with you. WorkSafe is Victoria's health and safety regulator, and we're also the workplace injury insurer. So this means essentially we have a dual purpose: to reduce workplace harm and to improve outcomes for people who may have been injured or become ill as a result of their work. So as the regulator, we enforce Victoria's occupational health and safety laws, dangerous goods legislation, and also the accident compensation laws. Put simply, we support workplaces to create and maintain a healthy and safe workplace so that at the end of each shift, whether that be night or day, people can go home from work to their families, to their loved ones, and make sure that they can do that safely and in great shape to enjoy the things that we all love doing with our families and loved ones. We do this through a mixture of information, education, and enforcement. Throughout 2022, we've made almost 32,000 workplace visits, and we've issued just over 8,000 prohibition or improvement notices. We've had 105 prosecutions, and we've seen 92 of them result in a successful outcome in terms of fines or other penalties or other improvements issued against employers who have not done the right thing. As the workplace injury insurer, we also provide holistic support to help those who are injured as a result of their work to recover, to return to function, and to return to safe work. We do this through a range of benefits, including weekly income payments, hospital, medical, allied health treatments, personal and allied help, and lump sum payments for those injured workers with a permanent impairment. Most importantly, We're really proud to say that last financial year, we supported more than 22,000 Victorians return to work after a workplace injury. Our dual purpose, as I said, reducing workplace harm and improving outcomes for injured workers. It's what we do, it's why we exist, and it's our commitment to the Victorian community.
Oh, great job, Colin. Really appreciate you sharing that with us. If I could stay with you for just a second, in terms of WorkSafe's role in preventing workplace harm, can you tell us about what WorkSafe is seeing at the moment in Victoria when it comes to workplace injuries and fatalities?
Yeah, I can, Cameron. And look, the sad reality is that we're seeing far too many people suffering from known, entirely preventable workplace injuries and illness. In 21-22, there were 28,600 new workers' compensation claims. And unfortunately, that is an average year. So 28,000 fellow Victorians injured seriously enough to have a workers' compensation claim each year. Just over 15% of all new claims now are for mental injuries. And that's up from 13% in the previous year. And we project that mental injuries will account for a third of all claims before the end of this decade. And we're also seeing more injured workers remaining on the scheme for longer, especially those with a mental injury. Now, you may be surprised to learn that around 73% of injured workers with a physical injury, they're back at work within 6 months. But unfortunately, the same can't be said for those with a mental injury. Only 40% of those with a mental injury are back at work within 6 months. So not only can mental injury claims take longer to recover from and to return to work and return to function and the things we love, but they're also very costly for the scheme. And more importantly, they're very costly in terms of the human cost and the overall cost to our community. And so while return to work outcomes are better for those with physical injuries, we know that if these workers aren't able to return to work within 2 years, they will likely go on to develop what we call a secondary mental injury. So they develop a mental health condition as a result of their physical injury not improving. So I think you can see why our dual role is so important, from prevention of harm through to recovery, return to function, and hopefully return to safe work. Sadly, in the last financial year, in fact, tragically, we've seen 68 workplace fatalities. This has included 13 in manufacturing, 11 in agriculture, and 10 in construction. And when we look at the cause of these deaths, 20% were related to falls from heights, 20% from vehicle incidents, and 15% from long-term contact with chemicals or substances. Now, these are well-known, long-standing workplace safety issues. They've been with us for centuries. And frankly, as a so-called modern society, it's simply not good enough that people continue to die from entirely predictable and preventable means. And we can't accept any number here other than 0. So we have a lot of challenges, but they're not ours alone. We can only support them we can only tackle them with the support of all Victorian workplaces and indeed the entire Victorian community.
Thanks for those insights, Colin. Some really important messages there. Narelle, if I could turn to you now, it sounds like people are still losing their life or being seriously injured in known or predictable ways, as Colin just said. What does that mean? What do you think is behind some of these incidents? And simply, why do they keep occurring?
Thanks, Cameron. It's really frustrating, and I think it may be that it's just old-fashioned complacency, or it's that belief that it just won't happen to me or my workers. But that's not true. We're seeing it happen all the time, and the things that we're seeing aren't new. So Colin's already mentioned falling from heights, which accounts for 20% of all workplace fatalities. So last year, that was 14 loved ones who fell from heights that aren't coming home. 14, it's just too many. And in that financial year, we had more than 1,300 workers' compensation claims just relating to fall from heights, which makes up over 5% of the total claims. And in fact, since 2018, there's been over 6,000 claims that just relate to fall from heights. Now, fall from heights aren't new. We've known about that since the Industrial Revolution. And we also know how to prevent them from occurring. There's some really well-known safety precautions that prevent people from falling, harnesses, platforms, and yet they're not being followed. And because of that, we're seeing serious injuries and fatalities. I know Colin's also mentioned vehicle fatalities, and also that 20% of our fatalities last year related to transport. We know that a lot of those involve heavy vehicles, and we know a lot of those involve maintenance or fatigue. 643 people put in compensation for road-related trauma last year. This is why WorkSafe now has a dedicated transport strategy. We need to reduce the number of lives that are lost in the transport industry and engaging in heavy vehicles. It's just, we know these are occurring, and we know how they're occurring, and we know why they're occurring, but more frustratingly, we know how to stop them occurring, and it's not happening. So as long as these incidents keep occurring, we're going to continue to talk about them. Hopefully, we're going to educate people, we're going to inform people, and we're going to make sure that employers take the necessary steps that they're obligated to take to ensure that people are safe at work and go home every day. WorkSafe won't hesitate to prosecute any employers that don't protect their people and they're failing their own duty.
Thanks for that, Narelle. Colin, quickly, just following up from that on what Narelle's talking about, do you think there are any other drivers at play here?
Yeah, thanks, Karen. I think there are many reasons that people still come to harm in the workplace. One is that it's hard to shift entrenched attitudes and behaviour. That's where WorkSafe's public awareness campaigns play a really critical role in bringing the community, employers, industry, and workers on the journey with us to drive home really important messages that aim to shift the dial in the right direction. For example, our recent agriculture campaign, "It's Never You Until It Is." This has been particularly powerful in influencing attitudes and behaviours, with more than half of farmers saying the campaign prompted safety conversations with their families. And I think it's really important. It's not just the farmer that campaign is aimed at and that it touches, but it's their families, their loved ones, their children, their friends who have responded and started that conversation, sometimes a tough conversation to have. We've also had a new campaign called which was developed by young workers for young workers. This furry orange character that we created as the star of the campaign helped give a name to that uncomfortable feeling, that sense that young workers can have when they see or are asked to do something that they feel is unsafe. And it gives them the courage to speak up and to understand their safety rights at work. And unfortunately, we see too many risks still being taken and too many shortcuts. It's now coming up to the end of October. We're coming to that time of year where traditionally there's a bit of a rush to get things done before Christmas. People are under increased pressure to finish work. Sectors like retail and hospitality, we see the intensity and increased demand really grow. And it's here when the pressure is on that the focus of workplaces can slip, risk can be taken, and there can be significant outcomes, catastrophic outcomes, in fact. And tragically, we also see many people die working alone. Consistently, we see that the overwhelming majority of workplace fatalities are happening to men aged between 45 and 75. Now, some industries are traditionally more hazardous than others: agriculture, manufacturing, construction. But there are ways to mitigate those risks. Narelle talked about some of the ways that we can reduce falls from heights. We should never, ever accept that injuries are somehow part of the job, somehow inevitable. They are all preventable.
That's a great point, Colin. I really appreciate you sharing that with us. Narelle, if I could jump to you on the point that Colin's making there, can you tell us what actually happens when WorkSafe is notified of a serious workplace incident or fatality?
Absolutely, Cameron, thank you. So notification of a workplace injury or fatality can come to us from a variety of sources. It can come to emergency services personnel like Victoria Police. It could be through media or unions, or even calls to our advisory line from workers or members of the public. And most of the calls that do come to WorkSafe, that follow a fatality would normally come from Victoria Police or an emergency service worker in that area. And just like where firefighters go to a scene where they suspect a fire might be deliberately lit, and then they notify police to come and investigate, that's how our inspectorate works. So we will go to a workplace health and safety incident, and if our inspectorate think that there may be a link to a breach of OH&S or even criminal liability, then we'll triage that, and then that will be notified to our investigators, who will then go and investigate it. Thankfully, not all incidents are at the serious end of serious injury or fatality, but there's way too many incidents. And last financial year alone, our advisory area received over 220,000 calls. That's an incredible amount. And each and every one of those calls are triaged. They're given a priority and they're forwarded to the relevant subject matter expert for action. In most cases, an incident referred to our inspectorate may be then required to have an inspector go out and go to the workplace and see what the OH&S breach may or may not be. But it's really important, and I stress, that an employer is absolutely obliged at law to notify WorkSafe of any incident where a worker requires medical treatment or hospitalisation.
Thanks for that, Narelle. You've both touched on really serious matters. Colin, as the CEO of WorkSafe, what goes through your mind when you get notification that something terrible has happened on a work site?
Yeah, Cameron, it's a range of emotions. I think, initially there's a sense of sadness, because I immediately think about the families and the loved ones of the person who's been lost. Then I think it's frustration and anger, because, we get a text message, it's called a code yellow, that says it's a serious incident or a fatality. And too often the circumstances are all too familiar. They're things, as we've talked about, that we've known about for years, and they're still happening. And so, sadness for the family involved, frustration, and then anger that we're still seeing this level of serious injury and death in our workplaces. And, we've talked a lot about statistics this morning, but these are people. They're not numbers. They're human beings. And one of the, I guess, the most important parts about my role, and one of the toughest things about my role, is meeting with the families of those who've been lost at work. Those stories stay with you. They're raw, they're real. And these people have such dignity and humility, and more than anything, they just want to ensure that what's happened to their loved one doesn't happen to someone else. And these injuries and fatalities, they have a ripple effect on the whole community, on workplaces, on sporting clubs, on teammates, friends, loved ones. And sadly, I think, some of those on this call today will know exactly what I'm talking about. And these ripples, this impact can last for generations. Just 2 weeks ago, 15th of October, we marked the anniversary of the collapse of the Westgate Bridge. 35 people died as a result of that industrial incident. That memory still haunts those who were there at that time, including the first responders. 52 years later, the impact is just as strong as it was at the time. And, I think about our inspectors and our investigators and the first responders at these incidents, and what they have to deal with, and what they, have to kind of quickly analyse to make sure that we take appropriate steps to try to ensure that we don't see a repeat. So I think it's a combination of sadness for the people involved, for those lost, and as I said, a sense of anger and disbelief that this can still happen in 2022 with everything we know about prevention. Above all, and I think I can speak for everyone at WorkSafe when I say this, it does make us more determined. It doubles our resolve to get up every day and to do everything we possibly can to ensure no other family has to go through that extraordinary, unnecessary pain and loss.
You're absolutely right, Colin. Thank you for that. Staying with you for a sec, we've talked a bit about what might be behind these serious injuries and fatalities that keep occurring. Can you tell us how WorkSafe is tackling some of these industries or issues in an effort to prevent workplace harm? What are your big priorities at the moment?
Yeah, thanks, Cameron. Look, we've made a very deliberate and I think bold statement that we want WorkSafe to be we want Victoria to be the safest place to work in Australia, and we want to be a leader amongst the world in reducing workplace harm. And so from WorkSafe's point of view, we will do everything in our power to prevent people from being injured or losing their life through their work. And that means focusing on those areas where we think we can make the biggest impact. So we've got 6 key prevention priorities. We're focusing on those workplaces where a large proportion of injuries or harm are predicted to occur. We're using data and insights and intelligence-led work to inform these efforts so we can get to the source and prevent harm occurring in the first place. We're focusing on addressing the most prevalent causes of fatalities, which we've talked about this morning: falls from heights, vehicle incidents, and occupational disease. And we're strengthening our approach to creating mentally healthy workplaces, equipping employers with the tools and resources to understand their obligations, and importantly, how to control psychosocial risks in their workplace. We're protecting the Victorian community against high consequence industrial incidents with our regulatory work with dangerous goods and the state's major hazard facilities. I think everyone will remember those major industrial fires that occurred in the last 2 or 3 years, and the work we're doing to ensure that never happens again. We're maintaining a very proactive oversight of current and emerging occupational illnesses and disease, such as silicosis and lead. And we're consulting and supporting Victoria's network of health and safety representatives. We know that HSRs make such a positive difference in workplaces across Victoria. They're our eyes and ears on the ground. There are over 300,000 workplaces in Victoria. WorkSafe can't be in all of them at all times. We need our health and safety reps to be there, to be our eyes and ears on the ground, and ensuring that they are enabled, confident, and supported is a key priority for us. So focusing our efforts on those areas, we believe we can make a positive difference to the health, safety, and well-being of Victorian workplaces.
Thanks for that, Colin. Narelle, turning now to mental injuries, which have been touched on a little bit already this morning. Can you tell us what being mentally healthy is all about in a work context and why that's so important?
Absolutely. Thanks, Cameron. So as Colin mentioned earlier, mental injuries are growing and they can be more complex to recover from or to return to work from. And that's why prevention is so important. We need all Victorian employers to understand that their obligation is to ensure that the workplace is both physically and psychologically safe. Physically and psychologically. And because the hazards that pose a risk to psychological health, they're no less harmful than those that place a risk to physical health. The cause of mental injury is potentially not what some of us traditionally think. So some in the audience might think that post-traumatic stress disorder may be the main cause of mental injury in the workforce. And in fact, around 75%, 3/4, really are as a result of a breakdown in interpersonal relationships. So stress, bullying, gendered violence, which does include sexual harassment, a poor workplace culture, these are examples of a breakdown in workplace relationships. So you can see why these injuries might make it harder for somebody to get back into the workplace where their injury was caused in the first place. I think what's really positive with the discussion about mental health is that healthy workplaces are now proactive, positive and productive in the discussion around being healthy, mentally healthy. I think that people are much more freely speaking and consulting with their employees about mental health and the end result, and they really want to get the very best out of everyone that they can. It's really important, and I absolutely believe that employers are realising the benefits of early intervention to prevent injuries from occurring in the first place. The employer benefit though through a reduction in absenteeism, lower staff turnover, high staff engagement, productivity and morale, makes their business a business or an employer of choice. And that's how you keep really talented workers. But I'm really pleased to say that if anybody's interested in learning more about mentally healthy workplaces in this Health and Safety Month, and I would suggest that it's a great opportunity, I encourage you to jump onto one of the webinars, and we've got one coming up this week on Wednesday, which is called Managing Psychosocial Hazards in the Workplace. Get on board. It's a really good one to watch.
Yeah, thanks for that, Narelle. That's great. There certainly is a terrific lineup of webinars right throughout the rest of this week. So anyone who is on right now, please jump onto any of those that interest you. Colin, just back to you again for a second. What can employers and workers in the audience today do to create a workplace that is both physically and psychologically healthy and safe?
Well, I think the starting point is to understand, Cameron, that health and safety in the workplace is everyone's business. We all have a part to play in keeping our workplaces mentally safe. So if you're an employer, understand your obligations and take steps to review your systems of work and your processes. Get actively involved in understanding your workplace and your workers. Understand the injury profile and the individuals that make it up. Consult your employees and negotiate to establish designated work groups whose job it is to elect health and safety representatives. Now, as we touched on earlier, HSRs are so important because they facilitate communication and consultation, and they provide a crucial link between employers and employees, and they all have the same objective: to keep workplaces safe. They also have the knowledge and training to help identify hazards, assess risks, and develop workable solutions to create safe and healthy workplaces. All businesses should have HSRs because they add another layer of protection for employees in keeping your workplace safe. And if you want to learn more, I'm going to give another plug for another webinar. If you want to learn more about the value of HSRs, I strongly encourage you to attend the Value of Health and Safety Representatives webinar tomorrow morning. You can go to our website and register now, and it's not too late. You can also access WorkSafe's Work Well Toolkit. This helps identify risks to good mental health and put in place processes and systems for a mentally healthy workplace. And you can do that today.
Thanks for that, Colin. Narelle, and what about workers? What can they do?
Well, while the obligation to provide a safe workplace is with the employer, if you are a worker, you also still have an obligation to look out for your own mental health and also to educate yourself on the drivers of mental health issues such as stress, bullying, gendered violence, including sexual harassment, and they're all generally signs of a poor working environment or culture. So please, speak up if you feel unsafe at work. If you regularly work alone, please ask for support. Get to know your health and safety representatives and engage with them. I can't tell you how amazing the HSRs are and what they do for the health and safety in any environment. It's also really important that you be proactive and understand your rights and your responsibilities. Notify your employer straight away if you see a potential hazard or risk. Don't walk past something that's going to cause harm to somebody. And don't forget, we've got an amazing team at our advisory centre, and we've got a great website that Colin's already talked about. Our advisory team, you can contact them on 1800 136 089. Program that number into your phone because they're an amazing resource and provide all the information that you need.
That's a great tip there, Narelle. Thank you for that. It sounds like there are plenty of practical things people on the call today can take away from this morning's discussion, which is exactly what Health and Safety Month is all about, isn't it, Colin?
Well, that's exactly right, Cameron. And it's why Health and Safety Month is so important at WorkSafe. You know, as I mentioned earlier, there are approximately 350,000 workplaces in Victoria. And now, while we're the health and safety regulator, we can't do it alone. And as much as we would like, we can't be in every workplace every day to make sure that they are doing the right thing. So we need the help of everyone on this call to spread the safety message. And just by attending this webinar and other Health and Safety Month events throughout October, everyone here this morning is showing us that they have skin in the game, that they are determined, as we are, to improve health and safety in our workplaces. Because as has been mentioned, health and safety is everyone's business. So I just want to give a shout out and a big thank you for everyone who has joined us this morning, because it demonstrates their commitment to what we're trying to achieve and what we can achieve if we work together.
Well said, Colin. I think we all echo those statements very much. Thank you to both you and Narelle for being so candid and for sharing your insights. As I've mentioned a little bit earlier, I've worked with WorkSafe now for a number of years and have the highest regard for the work that you do to keep Victorians safe, including everyone on the call today. So thank you for your time today. We want to get into some questions now. There are a lot coming through, so I'll steer through as many as I possibly can before we run out of time. But to jump straight into one that a lot of people on the call are asking, and I'm happy for either of you to handle it or both jump in. Please just go for it. In mental injury claims, how do you deal with someone's perception, which is that their claim is based on? How does an employer mitigate that?
Well, I might start there if that's okay. Thanks, and thank you for the question. I think a lot of it comes down to the workplace culture. And as we discussed earlier, getting to know your employees is so important, because a mental injury or a mental health condition is almost always multifaceted. If it's not PTSD and specific to an event or an incident, it can often be something that's built up over time. And I think one of the really important things is that by getting to know our employees, by displaying some empathy towards our employees and really understanding the culture of our workplace. I think culture starts from the top, but it lives and breathes on the factory floor. Culture is something that is organic, and it needs to be constantly nurtured and worked on and improved. And I think if we can really tackle workplace culture, if we can get to know our employees and what some of the issues are that might be causing mental harm or distress, then we're really on the way to addressing those issues in our workplace and making a positive difference. Because we shouldn't forget that a healthy, safe workplace is actually good for your mental health. It can actually enhance your mental health and well-being. Satisfying work, safe work is good for you.
Narelle, if I can steer this next one to you, and a lot of people asking it, what are the easiest / best ways for employers to keep up to date with updating OHS legislation?
So I'll give a plug out to the HSRs, the health and safety representatives. They're all over all of this, all the changes that come through. We liaise with them very, very regularly to ensure that every organisation that has HSRs are very well aware of what the obligations are and what the changes to those obligations might be as we solidify and grow some of the safety standards. But also, once again, our advisory, they are just the font of all knowledge. If you do have any concerns, please call our advisory call centre and they will provide you with the information or pass it on. But any of our WorkSafe folk our WorkSafe folk will happily help and assist in any way we can. Have a look at our website. Fantastic.
Colin, can I steer this one to you because you've already touched on culture a little bit. Again, a lot of people asking this. We find our team see shortcuts and don't take the safety advice. We don't want to create the culture, the boss is coming, quick, do the right thing. How do you respond to that?
Yeah, it is a great question. I think the tone is set from the top in that regard. It is about, people respond to what the leadership of an organisation determines is important. And so I think if the business leaders on the call, if the leaders of any organisation on the call, if they make it very clear and in practice that the health and safety and well-being of their workforce is their number one priority, above all else, above profit, above productivity. The safety and well-being of your workers is your number one priority. that will then translate on the ground, and it will cause people to go, well, hang on, this is, if, you know, people do what is noticed, and, you know, we measure what matters. And I think there's a real opportunity here to demonstrate that above all else, we place the safety and well-being of our people. And I think that is how you start achieving that cultural change. Now, WorkSafe of itself, we're an employer of over 1,600 people. During COVID, we had a dual role. We had to be the workplace regulator, but we also had to make sure that our own 1,600 employees were safe and well throughout that period, as we do at any time. And we made it very clear, yes, we had a role to play in the COVID response, but above all else, our number one priority was the health, safety, and well-being of our own people. And that will never change.
And that comes from that strong leadership that you talk about. That flows on to the next question here, and happy for either of you to jump in on this one. Is there any safety awareness education that can be provided to people in leadership roles?
Narelle?
Yeah, there's a lot out there, and everybody has a responsibility. So safety is everybody's business. And you look at WorkWell on our website, and you'll identify some fantastic opportunities and learning environments within that. But expand that out. A lot of workplaces have their own leadership training and development, which also includes the essential component of what are your obligations under OH&S, and how do you lead by example and lead from the front to ensure that your culture is right up to the company directors course, which absolutely identifies the obligation for boards and executives to lead by the front and ensure safety is the number one priority. My daughter goes to work. I need her to come home safe every day, and I want her supervisors to know that they have skin in that game.
You've both touched a lot on the mental safety and mental injuries at the moment, and I've got a couple of questions coming through regarding that. This one, a number of people asking, do you think that more workplace psychologists / counsellors would be able to reduce this increasing trend in mental injury?
Look, I think a lot of workplaces have employee assistance programs. For example, we do. And I know a lot of other employers do as well. I think ultimately we need that, but I'd rather, you know, it sounds a bit ironic, but I'd rather we didn't need it, because we had the culture right. We had the systems and processes in place that people could be and bring their best self to work, and they didn't need those services. Unfortunately, we're not there yet. And so we do need those services. But ultimately, you know, we're in the business of prevention rather than cure. We will always put prevention above cure, because, you know, my job as a CEO is essentially to put our insurance business out of business, because that means people aren't getting injured at work. And I'd love nothing more than to see us come to a day where we don't need a workers' compensation system, because people are no longer getting hurt at work. So yes, there's definitely room to improve health, safety, and well-being and interventions, but let's start at the beginning. Let's try and prevent those conditions from developing in the first place.
Narelle, I've got a question here that just needs a little bit of clarity, I think, on one of the points you touched on throughout your chat here. And a few people are asking this. You mentioned that medical treatments and hospitalisation need to be reported to WorkSafe. I thought only serious medical treatments were notifiable. Can you respond to that?
So medical treatment where somebody's actually got a serious injury or they've been admitted into hospital. So they definitely have to be notified to WorkSafe immediately.
Okay, great. Thank you. Next one here coming through, and again, a few people asking that. What support is there available to help workplaces understand consultation on safety matters, and if we need HSRs in our workplace?
Narelle.
Sorry, so can you repeat that one?
I can. I'll have to find it as I scroll through. Here it is. What support is there available to help workplaces understand consultation Sorry, my screen's just jumped there. Consultation on safety matters and if we need HSRs at our workplace.
So let me tell you that you do need HSRs at your workplace, in every workplace, as many as you can. They're the ears and the eyes on the ground. So please do that. We have an amazing HSR liaison group working with us here at WorkSafe, and we will provide any support you need to try and get that up and running, because everybody has a role to play in health and safety in the workplaces, and we can't be in every workplace. So get your HSRs into your workplaces and they'll make sure that you have a very happy, healthy culture and work is great. So reach into our advisory unit as well. We also, I know I keep saying this, but the WorkSafe website is amazing. We have a lot of really talented folk and they've put a whole lot of amazing resources on the system. So go and have a look into our WorkWell and have a look at what's there in terms of how do you have an election for HSRs? What does it look like? What does a designated working group look like? What are the responsibilities to support them and grow them? And how can we do that for you? So if you haven't got a health and safety rep in your workplace, you're doing yourself a disservice. Get one as soon as possible. Trust me.
Well, on our question here, Carmel points out exactly what you're saying, Narelle. The WorkSafe OHS Essentials program is an excellent incentive for businesses across Victoria to assist and support safety within small and medium-sized businesses. A number of people giving that one a thumbs up there. One last one for you, Colin, on something that you've touched on already, but Megan asks, how do we get management to see OHS as an integral part of all jobs rather than as another overhead to be minimised and outsourced to an OHS division?
Yeah, thanks, Megan. I think it is a great question, and it comes back to, look, at the end of the day, it's actually it's a legal responsibility, but more importantly, it's a moral responsibility. And I don't want to get moralistic, but at the end of the day, we have to put people first. We have to put people above all else. And, you know, look, I'm going to be a little bit blunt here, but if you don't put the safety, the well-being of your employees above all else, then I would suggest you're not a leader, because that's what leaders do. Leaders are about putting their people first, about ensuring that they can thrive, that they can be their best. That's leadership. And if you're not in the business of doing that, then maybe you might want to think about doing something else. There's a big difference between leadership and management. Management is about making sure tasks get done. Leadership is about creating the environment for those tasks to get done and to be done safely, and then everyone benefits. A safe workplace is a productive workplace. There's no two ways about that.
That's a great message, I think, to leave us on, Colin. That's fantastic, everything you're saying there. There are so many more questions coming through that I'm not going to get time for, but can I just assure everyone that we take down all of these questions, WorkSafe keeps them, and they bring them up, table them straight away and act on any that need following up immediately. So we do have those questions and they will be followed up on. So thank you so much for everyone who's engaged in those questions. Colin, thank you so much for joining us this morning. Really appreciate all of your insights today.
Thanks, Cameron. And look, can I just say to you, thank you for the role you've played over many, many years during Health and Safety Month and in supporting WorkSafe more broadly. And thanks also for sharing some of your own personal story and your dad's story, which was so powerful. So thanks for everything that you do as well.
Oh, thanks, Colin. I appreciate that very much. And thank you to you, Narelle. I know you've been out speaking at a few events right across Victoria, and for joining us again today. Thank you for your time.
Thanks, Cameron. Great working with you. I echo Colin's comment, so thank you very much. And I just really want everybody to know that health and safety in the workplace is everybody's business. So please help us help you, making sure your loved ones come home safe every day, every night, always.
A very important message there. And we hope that everybody who has been joining us this morning has found it informative and interesting as well. This webinar will be available online via WorkSafe's website in around about a month or so's time, so that you can view it anytime if you want to go back and just recheck any of the points that Narelle or Colin have made today. We will note on the screen shortly some contacts where you can find information around how to prevent harm in your workplace. If you have any requests for further information, please get in touch. Please ask those questions. And remember, if there is something you want to discuss urgently, there is the WorkSafe advisory line. And don't forget, the emergency line is open 24/7. So please get in touch. We really appreciate your time. Enjoy the rest of the day. All the best. Thanks for joining us.